Welcome to the Growth Lab. This is the podcast dedicated to the business of beauty and vitality. Today, we are sitting down with LaMont Levitt, which is the founder and CEO of Innovi Health and fellow podcaster on fountainofvitality.com. It's an amazing practice that features medical coding. Let's find out more. This episode is brought to you by MedSpa Accelerator. We help medical practices and med spa clinics solve the bottleneck of inconsistent, unqualified patient leads to achieve a predictable, scalable monthly revenue without staff burnout. We're absolutely thrilled to have LaMont here to discuss the future of medical coding and patient care and some of these unique tests that he has as well. Let's get started. Good afternoon, Lamont. How are you?
Great, doing great. Thank you so much, Jason, for having me on your podcast today.
You're very welcome. And I'm excited to dive into your story, Lamont. I like to frame these conversations simply past, present, and future. I want to start with your origin story, how you got into medical coding so long ago. And then I want to pivot to your present reality of what's working, what's causing friction, and what's keeping the doors open. And then finally, I want to look at the future outlook of the next 3 to 5 years and the biggest strategic moves that you're planning. That way, we're going to cover full spectrum of building out a successful business. Does that sound like a good roadmap?
Yeah, that sounds great.
All right, sounds like a plan, my friend. Well, it looks like you've been doing medical coding for about 20 years now, since 2008.
Yeah, that's right. That's when I got into it. As far as how I got into that, interesting story. First job out of college, I was a mainframe programmer back in the day, and then for years, about over 18 years, I was at a company called Novell, big into the whole networking of the 90s, all that, the 90s and 2000. That was a fun time post mainframe world. So as the internet then took off and started to do its thing, we moved from mainframe to intranets to more internet life. In the internet space, my dad had a company called the Code. At that time, it was just servicing chiropractors, and I met with him and we decided, what if we take this out to all professions? And so that's what we did with Find a Code. In 2007, 2008, that was the first one of the first web-based coding billing tools out there on the internet. When you first start, you think, oh, I'm going to build a fun little coding platform. Well, then it evolved as customers came to us and they wanted more billing things and more auditing things and more add-ons from the not just the AMA, but the ASA, ADA, HA, all the associations and
Yeah.
all of so what Find a Code really became was a one-stop shop for anything medical coding, billing, auditing from everywhere. But when we work with us, you don't have to go hassle as much with all these different relationships with all these vendors. You have one place where you can figure out what you need to do. If you don't get reimbursed properly, figure out why. New codes come out, old ones get removed, deleted, and how do you manage that and navigate that? So that's really what Find a Code became. And then because we are a tech-related company, we really focused on what do people need and how do they need it. So maybe they want it integrated into their system with a private label. Maybe they want a single sign-on, or maybe they want some APIs to fit into their platform. So we've done a variety of things to meet people's needs. I've always believed in the industry, it's about co-opetition, not competition. We compete with our competitors out there, but we also cooperate. If a customer needs something from us as well as someone else, we figure out how to keep the customer happy, and that's what life's all about, right?
Yep.
So that's Find a Code. Then after that, the insurance companies came to us and said, we love what you've done with Find a Code, but what we really need is something a little different on how it's displayed, how it looks, and how can we get through as many charts as quickly as possible to make sure they're right and deal with all this HCC type work. And
Uh-huh.
that's how HCC Coder was born, and that to really service out those people that are in that role. So that's HCC Coder. A couple years after that, we launched QPro, which is for qualified professionals. It was a website for it's a membership organization, and then you have a variety of tests that are a variety of different specialties out there. So we might fill some gaps in roles where people may not have the certifications they're looking for from other entities, but we can fill some of those subspecialties. Also, after that, we got talking with a company called MetaBrev. It's spelled MetaBrev, but metabrev.com That is an acronym database of anything medical. So oftentimes you see a chart note, it might say the doctor might say XYZ with this ABC something, and you go, what in the world are these acronyms? Sometimes a doctor will use them in his context to make sense, and maybe this his or her staff's like going, "What the heck is he talking about?" You can go into a MetaBrieve, figure out what is that three-letter acronym or abbreviation, and what are the 20 different things it could mean, and then figure out what they're talking about. So it's a real nice database of acronyms, and we then integrated all of those into Find a Code and HEC Coder too, which is what our customers were asking for, a search that was more than just, a word, but what are all the acronyms and abbreviations that are used in the industry. So we have over 100,000 abbreviations now with that product. Shortly after that, well, it was right in that time that there's so much movement with AI, and we started out a few years ago starting to use AI more in our sales and marketing processes.
Yeah.
But it was really last year that we really hunkered down on, okay, how do we make product improvements? What do we bring to the market that people really need, not just make something for the sake of making it. Sometimes people make AI products without really knowing what kind of problem they're trying to solve. We built out what we call Innovi Scribe, and it's ambient listening scribe for doctor-patient interaction. And as you're talking to the patient, all of the ancillary conversation that happens that's not really related to the actual healthcare. They might have talk about their kids or the football game last night. All that stuff gets kind of weeded out. So from that, you have a transcript created. From that transcript, you can either do an H&P note or SOAP note or any custom note that can then go into your EMR or EHR. And then you can either cut and paste it, or if you want a full integration, we can do that too. But that's that's the foundation of what Novi Scribe is. We just launched that just the very end of last year. This year, we've been working on all along, what's kind of fascinating is we recognize how great our tools are inside Find a Code and HTC Coder, but a lot of people are liking that AI type dialogue where they want to ask a question like, can I build this code with that code in this locality under these circumstances? Or what's the commercial payer policies that come into play? All that kind of thing. Instead of having to look through all the information to get your answer, you can ask Amy, our new agent, and Amy will go down inside our databases and pull all that information out. You know, and get a correct answer. I talked to one auditor who told me that they like to use AI out there, but then they always go back to find a code just to be sure they're getting the right answer. Because sometimes you get hallucinations, right? With AI, it's
Mhm.
AI.
Always gotta verify, right.
It comes back with, it just knows for sure the answer, but it'll make stuff up if you're not careful, or what's its source, right?
Yeah.
So, what's nice is Amy will go off curated sources that we've been working on for years and years, many years. So, it will really help people a lot in that role. So, that's what Ask Amy is, and if you're in any kind of coding, billing, auditing environment where you need an extra assistant there that can really dive into curated information, you'll need to get with us and ask about Amy. And that agent's coming this year. So we've already given a few webinars showcasing what's going on, and a lot of our customers and new customers are excited about what's coming.
Okay. Wow, that's great. So, do you primarily serve then providers then that are is it subscription based? How does the business side of it work?
Yeah, it's a SaaS. These are SaaS based products.
Okay.
So basically, you sign up, and it's role based. So when you sign up for, say, Find a Code, you may not need everything that we offer. More than likely, you need a subset of what we offer. Let's say you come in as let's say you're an anesthesiologist, or you do anesthesiology type billing, you would be just get the pieces you need. Or maybe you're a dental type role. So it just kind of depends. If you're an auditor, you're going to have to get more things because you're solving harder problems. Whereas if you're just entry level coding, getting through stuff, it won't cost as much because you don't need as many ancillary pieces to do your job.
Yeah.
So
Okay. Yeah. Great. Great. That makes a lot of sense. Now, what do these platforms cost providers? I'm sure they all vary in different costs.
yeah, yeah. So if you go to findacode.com, there's a pricing thing. You can drop down there and see, what is it you want to buy. There's a lower end and a a mid-range and a higher end with add-ons as well. So you just kind of say, where do you fall? If you're a hospital, you've got more other code sets you've got to worry about with ICD-10 PCS and UB04, and maybe you want to pick up the AHA coding clinic because you're doing hospital type billing and coding. And then we have add-ons too for additional newsletters. We're one of the biggest uh, encoder type products out there that have a variety of newsletters and other options that you can pick up from other suppliers, other vendors, and competitors too, for that matter.
Yeah. Okay, great. Wow, that's so amazing. And what are some of the biggest goals that you have for all three of the SaaS products here in 2026?
So, for in the case of Find a Code, we want to get more awareness out there of all that it can do. For those that had looked at it 10 years ago or more, they might have recognized it as a coding product, but it does so much more than that. That's just where it starts. So getting out to the billing market, to the auditing market, help them understand what a powerful tool it is. There are some doctors and nurses that also use it too, but usually their staff is what needs that product. GC Coder is well entrenched in the insurance company. It's just a matter of us getting with more insurance companies out there and to add to the ones we already have to realize this really can help you deal with HCC type coding faster. And it's just a great tool and a great resource. So a lot of these people that do in that field, they'll have maybe one screen up doing their work, trying to figure out what's going on with their coding and building, then they'll have the other screen open as the resource tool as they're trying to work through those kind of issues. So that's those are our 2 big pushes. I think it's more the getting the word out there, more helping people solve their problems. Sometimes I remember one insurance company came to us and said, "Oh, man, I wish we would have found you a month ago before I signed my long contracts." A lot of times
Boy,
you have people that are queued up that are just kinda waiting for their contracts to end before they jump on with us, whether it's a 1 year or 2 year contract or even 3 sometimes.
yeah.
I think what's important with any product, and this goes for with anyone. My grandfather said, "You don't go into business, you grow into business." You know, what that really means is you don't just it's more than hanging your shingle. You have the patience to be there, show up, and keep showing up, and wait for others to other competitors to make mistakes. We had one client that just walked up to our booth at a convention last year and just said, "You know what? I know who you guys are. I know what you have. My existing provider's having trouble and for a variety of reasons, and I wanna take my whole company and switch over to you guys." And that's the kind of sale that those are easy, but you have to have been there a long time and be patient, and that's the whole growing in the business that happens.
Right.
Be patient for that growth.
And thanks for sharing that. I didn't really hear a definable goal though, for 2026 for each of those segments. Is it to get how many number of insurance companies on board? Is it to get how many more new providers for Find a Code? You've got to define those goals,
Okay,
or how do you know if
I'm
you're going
happy
to
to
hit
share
it?
more of that, yeah. Yeah, we have defined them as, this year we picked baseball terms. There's singles, doubles, triples, and grand slams. Eh, so a single is this big, and so we wanna say, we wanna have, you know, a handful of, singles to triples and 1 grand slam, and for Find a Code, and same with HCC Coder, we wanna have a couple singles, doubles, and maybe a couple 2 triples, but then that 1 grand slam. And those grand slams take time. You've gotta nurture them, and be content with a long sales cycle. Because the bigger the company, the more committees and approvals and past contracts to deal with to really get integrated. Sometimes grand slams take a couple years to land. We have had one customer we've been talking to for almost 3 years now, and finally, they're moving forward, but you just have to be patient for their cycles. And remember that in selling anything you're selling or trying to promote, it needs to arrive when they have the pain point enough to wanna make the change. And
Okay.
you can't force a pain point. You have to solve the pain point and then build around that. That's a good thing that we've all learned in sales time and time again.
Yeah. Okay. I think you defined it a little bit
A little
better.
better. And for MetaBrieve, I wanna pick up one new college every quarter.
Okay. Now that's a goal.
That cares about that cares about educating their students on what all the acronyms are, and we just slip that into their educational role. So I want to have a new educational institution every quarter added to that particular product line.
And what about the third one that deals with the insurance? How many insurance companies do you wanna pick up?
Yeah, we wanna pick up a new one every quarter as well.
Okay.
Every quarter.
Similar as MetaReef.
We're doing some unique things to make it easier for them to want to move to us as well. Whenever you think your product's done, what I've found is it's best to spend time with your potential customers, find out their pain points, and if you can solve their pain points in the process of introducing a new product, it's more than them just acquiring your product. You're saying, "How can I remove some administration or things in your life that are harder?" So that's what we're doing with HCC Coder first, and then Find the Code will follow the following quarter with some of those
Okay.
things.
Alright, fantastic. Now, if you look at your current lead generation system, obviously we're talking about B2B. What is the first point of friction or strain that you feel every single day when trying to qualify these, whether it's a, insurance company or whether it's, a hospital or whatever the new lead is coming in? What is that strain that you feel?
To me, we've used conventions. In the healthcare space, we've found that the larger the company, the more they're comfortable if they've met who they're doing business with. And so I like always showing up at the conventions where the decision makers gather. And sometimes we've had to kind of bounce around to find what conventions work best for us. So the first thing is start building those relationships out,
Okay.
do what we can there, and then put them in our pipeline, recognizing that well, they've got another 2-year contract. We're going to have to put that one on ice, but still talk to them and follow up with them, but on a slower cadence because they're
Yeah.
not ready to make a switch, and you don't want to irritate them in that process. So what's I going to say? Oh yeah. So that's the first thing is conventions. Really, that's important. We've done a lot of the social media kind of thing. We always out there reaching out. I'm using my podcast to try to talk to leaders in this space to get us out there and create awareness of our product line. So that's on the more of the social and the podcast side. As far as internally, after a convention, our sales team continues to communicate with those people that they're trying to land or do business with. One thing we also do is we have webinars on a regular basis, at least a couple a year, where when new codes come out or there's major changes, and we invite those on our email lists, whether they're leads or subscribers, to talk about those things coming, and we make those available for free. So that's one of our marketing methodologies to keep nurturing and building those relationships. And
Okay. Awesome. And now, what is your prime philosophy on delegating core business functions like appointment management versus keeping them in house?
right now, with the size of companies we're going after, we do keep that in house.
Okay.
We have got a pretty good sized company to where we got a good team, and I come from a technical background, so as far as programming and skill set, I keep as much of that in house as I can, and same with our customer support staff as well as operations and other functions. So that's kind of how we function. There are some things that we do a little bit of outsourcing when we need a little bit of help in a certain area for a period of time, but for the most part, it's internal.
What are those areas?
Sometimes with sales and marketing, I'll do a little reach out where when we've needed this little SEO help in the past, where maybe I was struggling with getting SEO on all our platforms, keep nurturing that, keeping that going.
Yeah.
We're looking at a lot of new AI tools, what they call AI EO or AI. The next generation of SEO, it's important to make sure that AI engines are aware of your company because as
Hmm.
people start to do more searching with AI, you need to be relevant on those engines, whether it's ChatGPT, Grok, Claude, etc. So
Yeah.
it's important to make sure you're out there. And you could do a couple everyone can do a couple tests. Sometimes there's 2 approaches with that. There's if you go search for yourself and you find yourself out there through one of the AI engines, that's great. But there's another stage of are you intentionally there? Are you did you or did they you just happen to be there because you've been out there in the industry? But I think it's important to make sure you're being strategic about SEO in the AI space and as you're making plans for the future. All companies should be worried about that as part of your marketing strategies.
Okay. Yeah. Absolutely. I agree. Now, you mentioned you have quite a few amazing goals right now, which is to get to one insurance company per quarter and to get one. I think it was what hospital right per quarter.
Oh,
Um,
yeah.
medical on the
Either
inner.
hospital or a larger clinic, yeah.
Yeah, or a larger clinic. Now, if you looked at the business right now today, what's the single heaviest anchor that you think that's dragging that progress down?
Let me think. Oh, there's a lot of different things you're working on all the time. I think you gotta take a step back as a leader of any organization and, uh, and go after the things that are dragging you down or have the potential of dragging you down. You need to look forward, first of all, of where you need to go, but don't get caught up too much in the spreadsheet psychosis of what you need to create a year from now or 2 years from now because so many things are shifting and changing. Focus on what you can accomplish this quarter, but don't, I think the biggest thing publicly held companies struggle with is they're so focused on that next quarter that they put off a decision that they need to be making now for something that will bring fruit 6 months from now or 2 years from now. So I think the great thing about privately held companies, which we are at Innovi Health right now, is we really can focus on what's the right thing to do for the business 2 years from now. What should we be doing right now or a year from now? Rather than getting too caught up in where there's an anxiety about, "Hurry, we gotta hit our numbers, we gotta make money in the next 4 weeks." I mean, that's all good and important, but that strategy is so important to not lose sight of. Figure out where you wanna go, but don't get too worried about where you think you're going in 5 years because things are changing. AI, there's new AI
Yeah,
tools, competition is cropping up in different areas, but just, put together a nice SWOT analysis where you
yeah,
look at your strengths, weaknesses, and opportunities and threats, and really look at those every 3 months, which we do. We follow what's called an EOS, the Entrepreneurial Operating System, where we follow
okay,
that model where every quarter as an executive staff, we're looking at those things and going, "Should we worry about that? Should we not worry about that?" Then every year, we go deeper on all those and really make sure that we're going in the right direction. The other thing
amazing. That's a
I
great
think
strategy, Lamont.
yeah,
That's
yeah, and I
great.
think with setting goals, I need to say this one thing I wanna say. Whenever you set goals, don't become so absolutely married to that goal that you just set for a 3-month goal. If something comes in, it's okay if you miss a goal because you have a bigger opportunity come in that really is a true opportunity. It's okay to have a goal not happen. We like to focus on what's called core. What's the critical operating revenue endeavors? What are operational revenue endeavors? What are those things that will generate revenue? And are we doing those things? And if something comes up that's a great opportunity, you don't want to tell that potential client, well, you know what? I have this other smaller goal over here that's more important to me because I got to finish my goals and not service that potential lead that's come in that when you can solve their problems. I mean, remember the people out there, your customers. I love the old Ray Norda quote he always used to say from back when I was in Nobel days 30 years ago. He'd say, customers first, employees second, stockholders third. The whole concept is we got to keep our customers happy because if the customers are happy, the employees are going to have jobs. Employees have jobs, the stockholders will be happy. So focus on the customer, see what they need, figure out who you can serve. And like you told me, Jason, once, you can't serve everybody, but figure out your niches. Where are you going to be strong? How are you going to be different to where you do stand out in the crowd? And that's so important to not
Yeah.
just be,
The
yep, just another
market
one.
rewards uniqueness and the market rewards differentiators. You can't be everything to everyone.
Yeah,
Would you
and you
agree?
gave me some good examples, yeah, of it's you figure out what your target is, and put your target around what your passion is too, because it comes out. If you're excited about something as a leader, build your passion around that uniqueness, and, people will gravitate to it. It's real.
Yeah, absolutely. And just like earlier when I was on your podcast.
Yeah,
Yeah.
yeah.
Well, that is a fantastic breakdown, Lamont, and thank you so much for being so candid about the operational reality. I think we've covered a lot of ground today from your origin story to the future of your medical coding businesses and all the different services that you provide, with Find a Code and all the other ones as well. I know that I hope at least some of our audience will get some value out of this. I think so. And with that, we're going to go ahead and wrap up the recorded portion of the Growth Lab. And thank you so much for joining us today.
Thanks again. It was great being here.